Good morning. I almost said good afternoon. Welcome to the update from the Department of Behavioral Health. It's been a couple of weeks. Today is April 1st, which is April Fool's Day. I wish I could tell you that the last year was all a dream. For those of you who are my age, you might recall a TV series from many, many years ago that had an entire season where one of the beloved characters was killed off. The show was called Dallas. And the next year, someone woke up from a dream and the whole season was a dream. But unfortunately, COVID is not a nightmare or a dream that we can wake up from. So with that, we'll move forward with the presentation. It has been a year since we entered this COVID pandemic, and so I did want to kind of refresh our memories of where we were a year ago. So the first slide I could find from about a year ago was March 20th of 2020. At that point, we had 265,495 cases across the world and had experienced a little over 11,000 deaths. You can't even see how many U.S. cases are on this slide because we had so few of them. The following week, less than a week later, we had 454,000 cases in the United States and over 20,000 deaths. We were now at that point doubling every less than a week. And then 1 week later, on April 2nd, we had 981,000 cases and 50,000 deaths. Again, a doubling in 1 week's time. So it's easy right now to look back and think, well, did we do the right things in shutting things down? It's easy to look in the rearview mirror and second guess things. But in those very early stages, we were seeing incredibly alarming information, a doubling of cases, a doubling of deaths every week. And under those circumstances, I think we can look back and say that the actions taken in a very calculated attempt to slow things down and even stop it, which was impossible, we now know, but there was a lot of effort made to address this very unknown virus that was rapidly expanding across the world. So back to current time, 1 year later, we went from 900 and some odd thousand cases worldwide to 129 million cases, and from 50,000 or so deaths to 2.8 million deaths. And in the United States, we're up to 30,462,000 cases and 552,000 deaths. In California, we now have over 3.5 million cases, almost 3.6 million cases, and just under 58,000 deaths. And just as a reminder, 1 year ago on March 23rd, that was 2,100 cases and 40 deaths. So again, huge growth in COVID during that time. I think when we go from week to week, it's easy to see the incremental increase, but when we really look back over a bigger period of time, you really can see that exponential increase. In Fresno County, we have 99,156 cases. We're now pretty closely approaching at least 10% of our population known having COVID. Because we know there's a lot of asymptomatic spread, and many of us who've likely had COVID and never knew we had COVID, generally that's believed to be an underrepresentation of the number of cases. We're now up to 1,609 deaths in Fresno County. And again, a reminder from a year ago in Fresno County, that yellow highlighted, we had 18 cases and no deaths. So it's really easy to look at that number and say, well, you know, it's understandable why people were alarmed and think that there was overreaction when we started shutting things down with only 18 cases. But even with those shutdowns, we've had close to 100,000 cases and 1,600 deaths. So it's hard to imagine how much worse that would be if we hadn't taken those measures. I'm glad we don't know. All right, where are we at with hospitalization? We weren't even tracking hospitalization a year ago, but today we have 115 positive patients. That was actually as of yesterday. And if you look on that slide in the upper left corner, you can really see how we're approaching more the lull that we had in the fall. We had that summer surge, and then things declined, and we're getting close to where we were then. We're actually not quite there yet. 27 people in the ICU and only 12 available ICU beds. And just a reminder again, we have a lot more than 27 ICU beds in the county, and so there's lots of people in the ICU for many other reasons, which is another reason we've worked hard to keep the numbers down so that hospitals weren't overwhelmed. All right. Tier system, positive news. Not only are we solidly in the red tier and now officially in the red tier, remember we had to be in the red tier for 2 weeks before we were officially in the red tier, but we're also in the orange tier in some key metrics. Our positivity rate, including our positivity rate under the health equity metric, are both in the orange tier. And so if we can continue to see the positive cases per 100,000 population go down, remember we have to get that number below 4. If we can get that 8.2 down to below 4, we can get into the orange tier. And since the tier system started, we haven't been in the orange tier. So it'd be really great to get to the orange tier. And at this point, I think our best chance is just to continue vaccinating people. But really positive news to be in the red tier. We have to keep vigilant. We have to keep wearing our masks. We have to keep, keeping that physical distancing away from people, even when we're vaccinated, to provide that extra layer of protection. I still have people in my family who aren't vaccinated, including people who live in my home. None of my kids have been vaccinated. And my mother and her husband have chosen not to be vaccinated, and so when I'm around them, I want to be careful. And so it's just that extra layer of protection. If we're going to get to this wonderful orange and maybe even yellow stage at some point, we've just got to keep up with those precautions, even when we're vaccinated. All right, so where are we at with vaccinations? Wow, 415,000 doses have been administered in Fresno County alone. And remember, we have a population of a little over 1 million. Not everyone is eligible to get the vaccine. Remember, vaccines still can only be given to individuals 16 and over, and only the Pfizer between 16 and 18. So when we look at just the population that's in the age range to get the vaccine, it's a bit lower than that. We have 124,000 residents who've been fully vaccinated. That means they've either received both doses of a 2-dose vaccine regimen or they've received the 1-dose Johnson & Johnson, and another 142,000 who are partially vaccinated. Just a gentle reminder that those numbers don't quite add up to those number of doses, but we also give doses in Fresno County to people who don't live in Fresno County. So somebody might work in Fresno County and be eligible, work at a hospital, let's say, and be eligible to be vaccinated here in Fresno County, but live elsewhere. And I know that at our vaccine clinic that Exodus has been running, we've offered and given vaccine doses to traveling nurses from the Department of Defense, doctors and nurses who had come to Fresno County during our surge, gotten their first dose elsewhere, and received their second dose through us. And so that's some of the representation of individuals who've been vaccinated here but not necessarily live here. All right. And then that key population of 65 and over, we have about 135,000 individuals in Fresno County who comprise that population of 65 and over. And at this point, over 68% of them have gotten even 1 dose. And the reason this is really important isn't just that they're vulnerable, but they are more highly represented in the individuals in the hospital and the individuals who die. And so we really want to protect them and protect our healthcare system by keeping them healthy and well. And so 52,000 residents have been fully vaccinated and over 92,000 with at least one dose. So we're making really good progress there. There's still a lot of effort, particularly in underserved populations, people who might live in a rural area or different ethnicities, that we really are putting some targeted efforts to getting that population vaccinated, particularly those over 65. So that will continue, significant efforts in that part. So I wanted to go over today what's happening with vaccinations across the world. It's very easy to become a little microscopic and look at our own area and worry about when we can go out and eat and when we can stop wearing masks and when our kids can get back to school and all the things that legitimately concern us with where we live. But in order to get out of a pandemic, we also need to look at what's happening across the world. And one of the reasons why that's so important, aside from simply caring for our fellow human beings, is that, as we've mentioned previously, one of the variables that makes predicting when the pandemic will end is those variants. We're still seeing some concerning outbreaks of those variants, both in California and across the United States and the world. Still a lot of work going into understanding whether or not the vaccines are effective enough against those variants. But the other thing, and we've talked about this before, is that the way that variants happen is by the virus passing from one person to the next. When a virus cannot replicate outside of a living host. And so only through replication do variants develop. Do small changes in the DNA of the virus impact how the virus behaves when it is in a living host. And so that only happens when a virus replicates, and that only happens when they're in someone. And so only when the virus is spreading are those variants happening. And the more the virus is spreading, the more the chance is that one of those variants will be more lethal or have a higher propensity to spread. And so until we really get that spread under control across the world, those variants will continue to happen. And we know simply by the way that COVID spread that even if a variant develops in Africa or Brazil or the UK, which are all well-known variants, because of travel and such, and especially if those of us who are in countries that have good vaccinations start traveling more, those variants will get to us eventually. And so it's in our best interest to ensure that we really, really work collectively across the world to ensure that vulnerable populations get vaccinated to improve the health and well-being of our fellow human beings, but also to prevent this virus from continuing to mutate, continuing to spread, and continuing to create havoc across the world. So 564 million doses of the vaccine have been administered across the world now. That's about 7.4 doses for every 100 people. But there's really big gaps across the world, including some countries that have yet to administer a single dose of vaccine. So how are different countries doing? This big map, the darker a country is, the more doses have been administered per 100 people. So rich countries like the United States are doing pretty well. If you look at parts of Europe and small parts of the Middle East and the Southeast Asian countries, there's little pockets where there's been more vaccine administered. But there's large swaths where either there's no data or very little vaccine has been administered, less than 5 doses per 100 people. In terms of by country, the country that's doing the best is Israel. They've delivered 112 doses per 100 people. So remember, with most vaccines requiring 2 doses, they're well ahead of the curve there, where most individuals in their country have likely received at least 1 dose of vaccine. or at least had the opportunity. The Seychelles is 100. United Arab Emirates is 84. And then you go down, United States is about 44. So you start to see where those countries are. Chile has done pretty well with 53, a little better than the United States. And then when you look at the share of the population vaccinated, in countries like the Seychelles, they have about 33% of their population fully vaccinated, and 65% have at least one dose. Israel is close, 53 and 59. And then you come on down, the United States is in the middle there, 16% of the population has had full vaccination, and about 29% partially vaccinated. But then it goes way down. So San Marino, which is a teeny tiny country, 5% of the population fully vaccinated. So lots of countries not even represented there are doing even worse. And so again, this you'll hear more and more about this. Recently, in the last week or two, President Biden has committed to making some doses available to some of those underserved parts of the world, particularly as it looks like with arrangements that have been made that we'll have plenty of doses in the United States for everybody who wants to get vaccinated to be vaccinated. And so rather than sit on a surplus of doses when other parts of the world are not getting vaccinated or not having access to vaccinations, that's a concern. Now, we did hear this morning that 15 million doses of Johnson & Johnson had to be wasted because of a problem in manufacturing. That's a concern, but in the larger scheme of things, hopefully that won't be catastrophic. All right, so that's what's happening in the world, what's happening in the United States. So this map shows you for individuals over 18 by state, and the states like Texas and New Mexico, Colorado, South Dakota, West Virginia, Virginia, and Georgia that look sparse, that's largely because we don't have data from them. So that doesn't mean they haven't vaccinated people, we just don't have a lot of data. But you can see that there are states doing better than other states and parts of states doing better than other states. Just like on the last maps of the world, the darker the bluish green color, the more vaccination that has occurred. So the darkest is over 50% of the population being fully vaccinated, and as it gets lighter, that's less and less. At 65 and older, you see a much higher percentage across the United States because that population has been prioritized for vaccination. So this map really shows that we have done a good job of prioritizing the 65 and over because they really, that dark over 50% being fully vaccinated is much darker for that subset of the population. All right, so when might we see everyone in the United States being at least partially vaccinated? This kind of shows you that on our current 7-day average of 1.75 million vaccinations happening in each 7-day period, we should anticipate that by mid-March, about 50% of the population has been vaccinated, and by the end of July, 90%. So we're really on pace by midsummer to have close to 100% of the people able to get vaccinated based on the number of doses available, barring any more unforeseen issues with manufacturing or distribution of the vaccine. So that's really great news. I think a year ago we would have been shocked. We were being told that it could take a year or more just to develop a vaccine, let alone get it to approval. And not only have we gotten them to approval, but we've had them administered on a scale like we've really never seen before. And so this is really, really positive information, and something we should all take heart, that we're on the right path, but we have to persevere. It's very discouraging, I know. I get lots of questions. How long are we going to have to wear these dumb masks, and when can we get out of this? And we are well on the way, but there are many different analogies I've heard, and we're not quite to the finish line, and so we don't want to we don't want to drop the ball at this point. We really have to keep wearing those masks, keep following those precautions. Okay, and a couple more quick slides just showing you by state how many people have had at least one dose versus being fully vaccinated. In terms of the one dose, those darker numbers really represent only about 33% have had one dose, and then in fully vaccinated, only 18%. So not to misrepresent, when you see those darker numbers in this slide, it's only about 18%. Okay, so we did start our vaccine clinic on March 17th for the people we serve, and that's been going on for a few weeks now. Not having a huge response to it. We are working with St. Agnes has a mobile clinic where they're willing to go out to some of our rural areas, so they're partnering with Turning Point to really identify for locations where there's not a community-based clinic accessible and easy for the people we serve to get to. We'll be coming up with a mobile clinic where they can go to those locations. So those efforts will continue. We are even willing to take our Exodus team out and do mobile clinics if we need to. Starting today, people over 50 can get vaccinated. So remember, the last tier that we rolled out, where the people we serve fell into that tier, was 16 to 64 with an underlying health condition. Now 50 and over regardless of health condition. And then on April 15th, it's been announced that we will go to anyone can get vaccinated. So if you have any loved ones, like I mentioned earlier, my kids, I plan to work with them to get them vaccinated once they're eligible in a couple of weeks. And I encourage all of you, as different tiers open up, and by April 15th, when anyone can get vaccinated, we do have a pretty robust system now for vaccinations. We're doing upwards of 30 to 40,000 vaccinations a week. And so you might have to be a little patient, but please rest assured we have a good distribution system in place. We're getting a good supply of vaccine in, and so a spot should open up fairly quickly for those of you who are looking to get a loved one vaccinated. And then there are many trials going on right now for the safety of vaccines in individuals under 16. Pfizer just announced that for the adolescent population of 12 to 16, their vaccine was 100% effective in keeping people out of the hospital and dying. And so I'm really hopeful that continued work will result in approval for vaccines for individuals under 16. And they're also looking at the safety of vaccines in women who are pregnant or looking to become pregnant, because there's just some lingering concerns about that. And so that population is also being looked at. And with that, I have other slides in here that basically just repeat what I've said before in terms of when and how we'll return to work. I do hope to have a return to work plan in place over the next few weeks, so that by the beginning of March, we should be able to give you a target date for when a return to work will happen. Again, barring any unforeseen changes in the trends that we're seeing in terms of COVID cases, hospitalizations, variant activity, etc. So that's always going to impact how we do things and the timing of how we do things. But we really hope to do that full analysis of all of the workspaces and recommendations for how those workspaces could be safely or not safely configured, and then have that plan in place to return to work. What I would tell all of you is that you will get at least a 2-week notice. My goal is to give you a 4-week notice, so that you can make arrangements for childcare and other arrangements you might have to make in terms of returning to work. I know I'll get asked about, will there be any positions that will remain telework? That's probably going to take a little longer for us to do. There's a number of implications, and so there's work being done with human resources, the main campus Maine County Human Resources, County Council, and our labor representatives on what that might look like. And so we're all going to have to be patient a little longer in terms of what that looks like, but keeping in mind our goal is to meet the needs of the people we serve in a safe environment. And so as we proceed forward, you have my assurance that that will be the foundation of how we approach it. Okay, let's see what questions we have. I can't worry about the world when my kids can't get a decent education from home and local shops I used to shop at are closed for good from political fear-mongering over a virus with this 95% recovery. I've certainly seen this opinion expressed in places in and outside of work, and I guess what I would say to you is that I think it's understandable. There is a lot of political divisiveness right now across our world in the United States and locally, and a lot of misinformation that's out there in terms of the impact of COVID on people's health and long-term health, and those individuals who unfortunately were hospitalized or have died of COVID. And so for some people, I'm not trying to change anyone's opinion about how we've handled the virus. My hope has always been to provide you with factual information, to encourage you to seek information from factual sources. We all have to make our own decisions about how we want to manage our own lives and what we want to worry about. When I share information about the world, I try and put it in the perspective of why I think that's important information, but I can completely accept that you may not agree with me. And that's the beauty of living in the democracy we live in, is that we don't always have to agree about everything. And so hopefully you find this information helpful. If you don't find it helpful, I can completely accept that. And this isn't a mandatory thing to watch. Okay. Yeah, and someone else said that they're anti from COVID, and so they guess not everyone recovers from it, and that's absolutely true. Sharing the information that I shared about the experience we had a year ago versus now is to try and give you a perspective that a lot of people have died of COVID. And if it hasn't impacted you personally, I can understand where it's difficult to reconcile all of the hardships you maybe have had to endure, and that's just something that we each have to resolve on our own. Anyhow, we won't talk about some of those questions in there. And then, was telework extended to a new date? It's my understanding that telework will be allowed at least through the end of May. And so, just as we've said previously throughout the whole pandemic, everything is up for consideration. And so we'll continually be looking at all of the metrics that have informed our decision making, both as a department and as a county. And if things start looking a lot better, that date could change. If things look worse in any way, it could also change. Again, what I would assure you is that we are working very hard to meet the needs of the people we serve in a safe environment. And so that will be the foundation of how we move forward. Let's see, I think I might have a question. Nope, no questions yet. We'll look here. Do you have any questions, Brian? All right. As usual, if questions arise after this, please feel free to email me or my assistant, Tina Young, and we will be happy to address them via email or incorporate them into the next update. I'm hopeful that as we move forward, we'll be continuing to report positive information, and that to everyone's benefit, we'll get out of this restrictions that COVID has brought us and get us to a better place. And just like some of our concerned viewers, I too am looking forward to the day when businesses are open fully, schools are open fully, and we can get back to some semblance of normal. And so have a good weekend, and I will talk to you next week.